Unfortunately, in 2021 and 2022, there was an observation that a piece of the device, the septum, which is an internal part of the device that's necessary for the refill procedure, was coming dislodged in a small percentage of the patients. So far, it's been about 5% of the patients in the phase 3 clinical trial. The device itself, you don't have to remove it. It's not a safety issue at this point, but it can't be refilled. So you have to go back to intravitreal injections. And, so when this happened, Genentech went and did a root cause analysis to sort of try to figure out, why was this happening? And it looked like the bond strength between the overmold, which is the top part of the port delivery system. Again, this is a very small device. It's about the size of a piece of rice, and it's placed surgically in the eye, can be accessed and refilled in the office. Part of the internal part during the refill procedures was becoming dislodged, and this is a septum dislodgement. It seems like there was a problem with the bond strength of this septum inside to the device, and also excessive forces made this more common. So they did two things technically to make it better. They improved the geometry and changed somewhat the glue procedure for this septum. And they also started to place some silicone lubricant on the needle itself, the refill needle. And doing these two things, they could increase the bond strength of the septum twice as much, and they could reduce the insertion force of the needle with the silicone lubrication by half. And so they did some testing then of, in vitro testing of these devices, and they aged them in a water bath so that about every week, I'm trying to think of 1 week of testing is 6 months of aging, because they age it in a warm bath. And so 21 punctures is 10 years of device strength. And initially with the old implant, with the old septum and the old needle, if you looked at a 10-year outcome of this using this in vitro model, there was a failure rate of almost 50%. So about 50%, if we follow out, of these septums would become dislodged. With the new needle, with the lubrication, you can improve the old implants' survivability to about 90% at 10 years. With the new implant and the new lubricated needle, they've tested it out now to about 30 years and have had no failures. So I think they've fixed the problem essentially, in that now patients and physicians can be comfortable that this septum dislodgement is not going to occur in the future. They've solved the problem, I think.